Welcome, welcome, welcome. I'm Lamborghini C, and I am back with another edition of Are You Ready for Business? I'm so excited about our show today because we actually have a special expert guest joining us. And so I cannot wait to get into the conversation. So, again, I'm Lamborghini C. I'm an entrepreneur. And so on this channel, we do talk business. We have a segment called Are You Ready for Business? So many times I have discussions around things that can help entrepreneurs and that are beneficial to them. So I am actually going to bring on a special guest. Help me welcome Natalie Stewart. Hi, Natalie. Thank you for
Hi.
joining us.
Thank you for having me. How are you?
I'm doing well. I am doing well. I'm so glad that you agreed to join me for this segment of Are You Ready for Business? I started this channel late last year.
Okay.
And I'd say probably a couple months in, I started to notice that I was talking a lot more about entrepreneurial things and just like things that I was kind of experiencing, in my life as I'm on my entrepreneurial journey. And so I decided to kind of create a separate segment entitled, Are You Ready for Business? And so on that segment, we talk about important things to have in place for entrepreneurs, and just, like kind of figuring stuff out because it's a journey, along the way. And it has been that for me. So my personal story has been one of transitioning from corporate America into entrepreneurship. And so I talk about that quite often. And so I did have a show where I touched or highlighted just all of the different types of insurances that entrepreneurs needed to have. And so one of those was healthcare. And so I wanted to touch on that, especially because I know for many people that are looking to transition or they may have thought about it, one of the things that may deter them from making the leap is the thought of, hey, having to go out and get benefits for myself versus having them supplied by the company. And so I am so glad that we have you here as an expert to be able to enlighten us and just educate us around the process of getting healthcare coverage as an entrepreneur, as someone that is out, on your own and not working for a corporation. So thank you, thank you, thank you. So first, I'm going to give you the mic and let you introduce yourself.
Alrighty. So I am Natalie Stewart. I am a licensed independent health insurance broker. So what all that means is I am licensed in 32 states to help individuals, families, self-employed primarily, entrepreneurs, solopreneurs find their health insurance, like you just said, when they transition from corporate America, when they lose their employer benefits, if it's a small business and there's not enough employees to to um, to have a group plan, a group employer plan. So like I just mentioned, I'm licensed in 32 states. So I just help lovely people like us that don't know where to turn after they lose their employer benefits. But just to back up here a little bit. So I've been doing this for 5 years. So I got contracted, got licensed, took my test, all that good stuff
Mm-hmm.
5 years ago. And it's just been a whirlwind since then. It's been the best decision ever. I'm self-employed as well. I don't have a boss. I don't have an employer plan for my own benefit. So that really caused me to have to jump in head first. Where do I turn?
Mm-hmm.
What do I do? How do I find health insurance for myself? So I did obtain my degrees. I have a bachelor's and a master's in healthcare administration. So I always knew from a young age I wanted to be in the medical field. I didn't know in what capacity. My whole family is in healthcare. They're all,
Wow.
dealing with patients. And I knew from a young age, I never wanted to be patient facing. I didn't want to be a doctor, a nurse, anything like that. I know
Mm-hmm.
myself well enough to know that I'm good with numbers. I like to be behind the scenes. So when I was going to college, I got my bachelor's, master's in healthcare administration. It was just perfectly aligned with what I wanted to do in healthcare. So a couple years after college, I was managing doctors' offices, and that was great. That gave me a ton of experience. I was really hands-on, kind of managing our patient load, all that good stuff, and the insurance side of things. So I really got to see both ends of the spectrum, the clinical
Mhm.
side and the administration side.
Okay.
And then I kind of transitioned away from that. I just kind of burn out. This was a few years before COVID. So I just really was like, there's got to be more out here. I was really seeing an uptick in just kind of lack of quality care, in my opinion, for patients. And it just kind of got discouraging, honestly. I'm like, I'm working a 9 to 5. There's just got to be more to life than this. So a couple of years before COVID, I, like I said, got licensed to do health insurance, got all my licensing for 32 states. And the rest is history. It's just been an amazing journey, but my heart has really just been for self-employed, solopreneurs, 1099 independent contractors, because we don't have an employer plan just handed to us on a silver platter. We have to go out and find our own coverage. So it's been really cool, just especially since COVID. A lot of people with layoffs and things like that, they just had nowhere to
Mhm.
turn, and they were kind of like, it's now or never. I've always wanted to start my own business. I've had this dream forever, and it's kind of the kick in the butt that I needed. So I really, through all that, there was that kind of silver lining of people just
Mhm.
going out, starting their own thing, realizing life is so short,
Yeah.
now or never, like I said. So that's been cool. Just being able to help people realize their dreams, make it come to fruition, and kind of take that fear away of,
Mhm.
well, I'm so used to having my employer plan. I don't know what I'm going to do without that. My family, dental, vision, it's just, it can be scary. So I just take a lot of pride and a lot of heart in being able to help people fulfill their dreams and not have to be tied to an employer plan or a job that maybe they're not so happy with, or feeling like they're stuck
Mhm.
somewhere. So that's just a
Yeah.
little bit about me.
Well, that's awesome. Thank you for giving us the background around yourself, because I think that is helpful as well, right? So, listen, guys. So, for anyone out there thinking, I want to go into entrepreneurship, but I don't know what I should go into, pay attention, as we talk to Natalie, because who knows, maybe this might be a career path for you to venture into. You
Yeah.
never know. So I think that is awesome. That's really great that it's still it's tied to what you got your degrees in,
Yes.
and worked in the traditional, kind of setting. And so
Hmm.
that's awesome that you're still, in that same field. Well, I will tell you, um, I love that you said that it's kind of your heart's calling, right?
Yeah.
Because you were a blessing to me. Because I was kind of joking with I joke a lot. Sometimes people, they're used to seeing me be so serious, right? As an HR person, I don't know
Hmm.
what it is, but sometimes folks don't think that HR folks have a sense of humor, but I do. Like, once I get to know you, like, I will just crack you up. But I was telling a friend last week about just the wonderful experience I had with you and how I set
Oh,
up my healthcare benefits, because I shared with them I missed enrollment. And so I was just out here living raggedy. I didn't have healthcare coverage in place. I was just chancing it.
I'm still in that line, living raggedy.
So I love it. I'm telling you. Yeah, I use it when I do trainings, because sometimes folks, they always want to be so polished, right? And I tell them, hey,
Yeah.
just feel free to be raggedy. But I
Yeah.
was being raggedy because I didn't have coverage in place. So it literally, I was really testing God's grace. And so thank goodness he was merciful. I didn't get sick or experience any injuries, no slips, falls, or trips or anything like
Yeah.
that. But I don't know, I just started it was just kind of on me, you know what, you need to get your health coverage in place. And so I went on to the marketplace myself, and I will tell you, as an HR professional with over 20 years experience, having helped many employees over the years through in our individual open enrollment, series, like in companies, it was a little bit daunting for me because I'm used to going through and maybe having to look at 3 or 4 different choices at most, from a corporation, and having to make your choice. And even then, like, I remember through the years, like, especially one of my buddies, Mike, we'd go back and forth. "Hey, I think I'm gonna get this one. No, no, I think I'm gonna change, because there were different price points, right, with them. And so imagine going from that to like the open market where after it asked me a series of questions, and it, with no exaggeration, it must have pulled up close to about 40 different options with different companies.
Yeah.
Some I was familiar with just, like through the years, like of course, Blue Cross Blue Shield, Blue Care Network, like some I've had, right? So I had some familiarity with them. But then there were some other names that I'd never heard of before and things of that nature. And so when I got connected to you, I think I kind of knew, or I thought I knew, which I want us to get into why you need a broker. So I thought that I knew, which is this is how I shop, right? This is how I shop for everything. Like I kind of go in a lot of times, like I tell people, usually I'm an easy sell because once I've made my mind up that I'm getting something, like it's not, like sometimes like I've been known to go into like a car dealership with the VIN number and give them the piece of paper and say, hey, can you pull this car around? I drive it a couple blocks down the road and come back and I'm like, okay, I'll take it. And they're like, like they didn't have to try to, sell me on it. But I thought that I knew the package I wanted. I think I had it pulled up and was shared it with you. And
Yeah.
so thank goodness that I was talking to you because as you began to explain it and the details around it, I saw that it wasn't really going to be a good fit for me.
Yeah.
And so I want to get into why you would need a broker because some folks may think, no, I can just go on my own, on the marketplace and do my own thing. Why should someone use a broker?
Yeah, so I actually get asked that probably almost daily because, yes, there are some websites you can just go onto, enroll yourself. Primarily, those are reserved for open enrollment period,
Mm-hmm.
which in most states it is November 1st through December 15th. That's kind of that 6-week time period where you can go online, enroll yourself into any marketplace plan.
Okay, I
And
want to pause there. Now, is that it for Michigan too?
yes, it
Okay.
is.
So
Yes.
guys, write that down. November 16th.
November 1st through
Oh,
December
November.
15th.
Okay,
Yes,
November 1st through the see, I'm messing it up already. So thank goodness you're gonna send me an email, right? And let
absolutely.
me know. Okay. So December 1st. No. Oh my goodness. Okay. November 1st through December 16th.
December 15th. Yes.
Oh Lord. Thank God I have you to send me an email. Because my
Yes.
goodness.
You'll start seeing commercials on TV, you'll get stuff in the
Okay.
mail, but yeah, so that's traditionally the 6-week time period of open enrollment. So during that time frame, you can go onto the marketplace. The marketplace is just a synonym for the ACA, the Affordable Care Act, Obamacare, the exchange. That all means the exact same thing. So in that time frame, and like you said earlier, there's usually at least 40 plans. In certain zip codes there's over 100, so there can be a ton of options. And usually in most zip codes there's 5 or 6 different carriers, like you touched on: Blue Cross Blue Shield, United Healthcare, Cigna. So there's a ton of options. But going back
Mm-hmm.
to the question, during that time frame you can go on, you can do it yourself essentially. That is for really designed for 2 reasons. You would do the marketplace route if you qualify for any income-based subsidies. A subsidy is just a fancy word for a discount, where if your income is within a certain threshold, you can qualify for discounts. So that's
Okay.
one reason we would want to go the marketplace route. 2 is if somebody has major pre-existing conditions or health issues, we would want to go that route because they have to cover all pre-existing health conditions. But
Okay.
on the flip side, there are plans through what's called the private market. You cannot, unfortunately, just go online and enroll into those. They have to go through a licensed broker. So
Mm,
those you cannot go online and enroll yourself. So that's why you would want to go through a broker, because you don't have access to those options online.
okay,
And you
so the
don't know
plan that
how.
I got, I would never have even come across it, right?
Correct. Yes,
And
there is
so
no. You cannot, they don't put any information online. You have to go through a licensed agent.
Oh, wow.
Yeah.
Okay.
Yeah.
Well, that's
So it's kind of,
interesting
yeah, it
because
is interesting.
I have to share with you. I don't know if I shared with you when you were helping set me up. Like when I was on the marketplace, I tried to sign up for a
Mhm.
package, and I was getting an error message. So I called the 800 number, and the gentleman that answered, he looked into it, and so he said, "Oh, it's because you're outside of open enrollment."
Yeah.
And he just left it at that. He did not
Mhm.
give me any options. He didn't tell me you might want to find someone that can help you sign up, you know,
They pretty
for a
much tell you
different.
tough luck. You got to wait till November.
Yes, and I've
That's
heard other people that I know are self-employed. So hopefully this will circulate and they will see this, say like, "Oh, I missed open enrollment. I can't
right.
get health care till." So there's some people out there that have the misconception, as I did, that just because you miss open enrollment, that you have to wait until November to sign up for healthcare, which isn't going to even start till January. That is a
Right.
myth. So we can
Correct.
go to a broker, we can go to Natalie, and she can get us set up with a plan outside of the open enrollment period.
Correct. All marketplace plans are limited to that 6-week time frame. If you try to sign up 2 days past open enrollment, they will tell you tough luck. You got to wait till next year, which to me is very unfortunate. That causes a whole other set of issues because then if something happens, you're uninsured. I talked to a lot of people that are in that boat and they missed their open enrollment window
Mhm.
by 24 hours, and the marketplace tells them, sorry, there's nothing we can do. So and to
Yeah.
your point, they don't really try to go the next step and
Mhm.
say, well, there are options available outside of this.
No.
So a lot of people go uninsured for that reason, and it's very, very sad. And you don't know what you don't know, so you just think that's it, and you go uninsured for the rest of the year. So
And
I'm really trying.
I'm gonna say it since I was in that boat. So that means there's a lot of people out there living raggedy like I was.
Yep, that's exactly right. Sad but
Yeah.
true, right?
Yeah. Yeah. Because we just don't know. And so I don't know. There was just I like I said, after that call, I guess again, like being an entrepreneur, I don't take no for an answer. And so
Yeah.
so I said, well, there has to be a way because that just doesn't seem right that
Mhm.
you know, I would have to wait like a whole 6 months before I could get health care. And
Yeah.
so I started doing some additional searching, and that's where I saw something about short term plans. And
Yes.
so, can you touch on the short term plans a little bit?
Yes. So traditionally, when you no longer have an employer option available, there's typically two ways to go about insurance. So there's the marketplace, which we've been touching on, the public marketplace, it's called, and then there's the private marketplace. Those are
Hmm.
the two routes that are considered full coverage insurance, meaning if the worst case scenario situation happens, the insurance company, after you hit your deductible and your out of pocket maximum, they have to cover all of your medical bills with no cap. So that's obviously great. That's the goal. That's the type of coverage I always recommend because, God forbid, you're in a major medical situation. If your bills are
Hmm.
$2 million, your insurance company has to cover that. They cannot tell you that you've reached a plan maximum, anything like that. Now, there's a third little subset, which is those short term medical plans you just mentioned. That does not fall under the full coverage category. And that just means that they have plan limitations. Sometimes it's 250,000, sometimes it's 500,000, sometimes it's a million for that policy maximum that they will pay out in the event of something catastrophic. So
Hmm.
I have unfortunately seen very young, healthy people. Their bills, they were on a plan that their cap was 500,000. One in particular, it breaks my heart, but he was a 26-year-old. He had a brain aneurysm, super healthy. His bills were $829,000. He hit his deductible, his out of pocket maximum. They paid up to 500,000, and he got the bills for the difference. So he had to file bankruptcy. Um, so just those policy limitations super important to read in the fine print, and they're typically marketed and sold as full coverage plans. But you'll see in the bottom it says STM, which stands for short-term medical, and that means that there is a cap to what the coverage is going to be. They're really designed for somebody to be on a short-term basis. They're appropriate for certain situations, maybe 1 to 3 months, where you're maybe willing to risk having that cap on the catastrophic coverage. They were never designed to be somebody's coverage for an entire 12-month period.
Okay.
It's designed for a certain type of situation. It's appropriate for very short-term situations, hence the name. But most agents don't market it as short-term. They tell somebody they can be on it all year, multiple years in a row. So I'm just very, very transparent about that, because I'm very hands-on on the back end with claims, with any type of issues. I don't work for any of these insurance companies, but it's my reputation on the line. I have good relationships with these insurance companies, with my clients. If something hits the fan, I'm going to be there to help them. And I do not want to be the one telling them, so sorry, your plan exhausted its benefits. Now you're looking at bills for $329,000. So I take that very, very seriously, because that all needs to be discussed and explained on the front end. And if somebody wants to choose that, then great. It's just not designed for a longer term period. So
okay, very good. I do want to mention, because I know we have a couple people watching, we do have the chat open. So if you guys have any questions that you want answered, go ahead and put them in the chat, and I'll make sure that we touch on those as well. One of the things that I know, I guess, is a misconception that I had, or it actually had me a little bit nervous to kind of go and search for the healthcare plans, is because, so I went into it kind of with the mindset that, oh my goodness, I know it's going to be like crazy, ridiculous as far as pricing. And so after I started to kind of look at what was out there, I didn't feel like it was that far. Of course, I expect it's going to be more, because, guys, keep in mind, you're paying the full premium. Right. When you're with an employer or corporation, a lot of times, like, they're paying a portion of the premium. I think a lot of employers have moved to a 70-30.
Yeah, anywhere between 50 and 70% an employer will typically cover. That's about average.
Now break that down. Who's paying what?
So on average, traditionally, an employer will usually cover 50% of the cost of that health plan. So let's say somebody's insurance costs $500 a month. Typically, an employer will pay 50% of that. The employee pays the other 50% taken out of their paycheck. So a lot of people get used to their employer, they're used to seeing that they're paying half.
So if it's 70-30, you're paying the 70. The employer's paying the 30%.
It can go either way, honestly. An employer can choose to pay 70% if they want. If that's the case, the employee pays the 30%. But I have also seen it flop. I've seen it where it's a small business. The employer cannot afford to pay 70% or 50%, so they'll pay 30%. And anything's better than nothing. But
well, I bring that up because I won't name, but anyone who was working in HR with me at that company don't know. Like, so we were prepped that we were like I think we announced to the employees that, look, guys, like, over the next coming years, we are working toward a 70-30 plan.
Yeah.
Right. And that was because of profit margins. Yeah. Right. Because of the increasing cost of healthcare. So they actively were working to put more of the cost on the employees.
Right.
And so, coming from that vantage point too, in looking at the price points that I saw out there, like on the marketplace, it wasn't like, oh my goodness, but I guess, like, are you able to kind of give like a high level range, just so people kind of know mentally in their mind, what they could expect for plans. Like on the
Yes.
low end, what could someone expect to pay? And then kind of what's maybe on the higher end.
Yes. So I get asked that all the time. And I was just talking to a friend earlier this morning, and he was like, I was quoted $900 a month for just me and my two little daughters. And I immediately
Mhm.
was like, that's way too high.
Okay.
So just based on the numbers, it's like after years, you kind of start picking up on trends. Now, I will say, it is going to be specific to the state that you're in. Florida is a more expensive state, Texas, California, New York. There's just certain states that are just unfortunately very expensive with their rates. So your zip code and your state has a lot to do with your rates as well as your
Okay.
age. So a 25-year-old male is going to be the historically the cheapest demographic there is for health insurance, and a 64-year-old male is going to be the most expensive. So that kind of, it does depend on your age, because the closer you get to age 65, unfortunately,
You
you're
have
viewed as
more
a higher
healthcare.
risk. You're a
Yeah.
higher risk to the insurance company. So,
Mhm.
and then a couple of other different little factors. If you're a tobacco user, typically your rates will be a little bit higher. Some certain plans will take your height and weight into consideration.
Mhm.
So that's another little factor. But kind of general rule of thumb, usually you can take your age. So let's say it's a 25-year-old individual. If you just add a zero to it,
Mhm.
$250 is a good ballpark of what your plan of an average plan. It's not going to be the cheapest plan. It's not the most
Okay.
expensive plan for their health insurance on a monthly basis. So if it's a 55-year-old, there are some plans that are $550 out there for,
Mhm.
somebody in their 50s if they're in a more expensive state. So that's a very kind of high level, like you said, way.
Yeah, just
Um, yeah, that individual I was just referring to, he is, I believe, 24, and he has two little
oh,
daughters. $900 is a lot for that plan.
yeah.
Um, so, and he's self-employed. He's a plumber. And he's like,
Mhm.
I'm just starting out. I'm trying to really keep costs low, and maybe down the road we can, kind of flip flop. I tend to just kind of, every situation is very specific. If somebody has a
Mhm.
strict budget, we got to work
Mhm.
within that, because to me, there's only one guarantee, and that's that you're going to pay 12 months of your monthly premium. You know, to keep your
Mhm.
plan, you have to pay your 12 months. There's no other guarantee that something's going to happen. You're going to hit your deductible, you're going to have hit your max out of pocket, anything like that.
Mhm.
So a lot of people really, just the last couple of years in particular, have really just come to me and they're really wanting something, but they need to prioritize the lower monthly cost.
Yeah.
So
So
that's
they take on the higher deductible for the lower.
exactly.
Yeah.
Yep. A lower monthly cost means a higher deductible, and the vice versa is true, where
Mhm.
you're paying more each month, you should have a lower exposure on the back end in terms of your
Yeah.
deductible. So,
Okay. Yeah,
yeah,
because I'll say I saw plans like even for myself, I'm mid 40s,
right.
um, in the 100s, but the deductibles and out of pocket max,
Was
they
$22,000.
scared me. They were
Yeah.
they were made me nervous. And
Yeah.
so again, at this stage and age in my life, I had to consider that. But yeah, somebody younger, like in their 20s, to them, they might be willing to take the risk because again, they have their youth on their side, and if they know
Yep.
they're fairly healthy and active, they
Yep.
might be able to take that risk to have the lower monthly cost. But I
Yep.
did see plans above 300, that were out there as well, like for an individual, and so again, there's such a wide range. One of the
Yep.
things that I want to touch on as well, I think I'd shared with you that I had a friend that that shared with me with the marketplace, and I did not know this, that again, because they do give subsidies based on your income,
Yeah.
like some people can get themselves into trouble. Can you talk about that a little bit?
Yeah, absolutely. Especially with working with a lot of self-employed entrepreneurs, it is very hard to predict your income.
Mm-hmm.
So, and the way in years past, the marketplace used to base it off of your prior year's income, which that's a no-brainer. You know what you made last year, you use that number, you plug it in, it tells you if you qualify, and if so, how
Mm-hmm.
much of a discount. A couple years back, they changed it to where you estimate your current year's income, which is hard to do in advance. You know, it's hard to know what your full year is going to be. But all that to say, so yes, so they have you estimate that number, do your best guess of an educated, ballpark number. But it's not just as simple as plugging in a number and going on about your day. They will reconcile your income the following year when you file taxes. They reconcile the number you reported up front versus the actual income that you made. Um, so I know you touched on your friends, and I've had some clients that unfortunately they underestimated their income, especially
Mm-hmm.
if you're right on that line, that threshold where
Mm-hmm.
just a little bit of a increase in income might bump you out of qualifying. So yeah, they will make you pay back that subsidy the following year. You have to cut a check to the IRS, which is never
Yeah.
fun.
And
Um,
I'm not talking like a few $100, like
yeah,
thousands. Like for this person, they shared like it was like 5,000.
yeah. I have a
So,
client that owes 6,000 because she made a $2 an hour raise. So that bumped her out of qualifying.
oh
And
my goodness.
yeah, so it's not a
Hold on,
great.
I have to do the math on that. Hold on. $2 an hour. Look, this
Yeah.
is the HR in me has to do the times,
Yes.
for a full year's work, it's 2,080 hours.
Yeah.
Oh, okay. So that's for an extra $4,160
Hmm.
before taxes,
Correct.
she had to pay 6,000.
Yeah.
Oh my goodness.
She was qualifying for a pretty large subsidy, so she had to pay
Mhm.
that subsidy back every single month for that 12-month period, because it's almost as if they view it as she should have never gotten that in the first place.
Yeah.
So they're going to do their due diligence, and I
Oh my
appreciate that. They
goodness.
don't want people reporting that they make $25,000 a year and they're really making $300,000 a year. They don't
Yeah.
want people to abuse the system. It's designed for people within a certain income range. But yeah, they're trying to do their due diligence and make sure there's no
Yeah.
abuse. But if you can qualify, you need to take advantage of that. It's
Yeah.
a savings for sure.
Yeah.
Um,
I say just keep it in mind because I think again, like I don't know any of us that go into business saying, "Oh, I'm just gonna play it low." No, there
right.
are a few people out there that are like that, but I don't understand that mindset. So
Yeah.
that makes me nervous, right? Because we want to shoot for the stars. Or let's say you get a really big gig, like late last year I got a call. It was kind of in desperation, like an emergency, kind of like, I have this client. I need you to, like, they need your help. You got to go in and help them. Like, I didn't
Mhm.
even have to pitch or be like, sell them on my company. Like, the deal
Love that
happened
for you.
quick and it was with a major, like, billion-dollar corporation. And, like, I got that call, like, on Wednesday. Well, I got an email Wednesday. The call happened Thursday.
Mhm.
Tuesday morning, I was on a flight flying to one of their locations.
Wow.
So, yeah. And so, again, like we want more of that to happen and we want growth and prosperity in our businesses. So I think just keep that in mind. However, I
Yeah.
do want to, I know we're geared toward the self employed,
Yeah.
but something comes to mind from one of my previous work experiences, and it was with my last company who actually was being purchased. So it was a merger, it was a takeover. And so they had us, like, the executive team and, those of us, like, they didn't take everyone over with that merger, but they asked us to stick around and help that merger go through. right? And so part of that was having meetings to educate those that were staying behind on like their new health benefits, their health care
Yeah.
plan and things like that. And it was like it really bothered me because I felt it was immoral what they were doing. So there was a segment of the workforce that made around 14.50 to $15 an hour. And the way that this new company's healthcare packages were priced, if an individual were to take one of the packages, like as a for themselves, not like one of the healthcare programs for them and a child, like for an
Mhm.
individual, every 2 weeks they would be at a deficit. Like
Wow.
that's how expensive the healthcare package was. And so I think that, and please correct me, but with the exchange, I
Mhm.
think that if you're like, there's a threshold where some individuals may have their health care covered in full, where they don't have to pay a premium. Is that correct? And if so, what's the threshold?
So are you saying when the coverage is free?
Yeah.
Okay, so yes, so that is through the marketplace. If your income is low enough, well, there's a couple different routes. So if income, again, kind of high level overview, typically in most states, if your income is under around $20,000, the marketplace will actually route you to your state's Medicaid coverage. Um,
Okay.
so Medicaid is typically under, again, every state kind of has a different threshold, but it's usually under $20,000. Um, Depending on the state, you'll actually be routed to your state's Medicaid, which is low income insurance. So that's depending on the income. And then usually anywhere based on an individual, based on the state, between 30 and 55 to 60,000. But more on the lower end, 30,000, 40,000, roughly, depending on your age too, your income, you might have a subsidy, a discount that's large enough to make your insurance free. So it's there's kind of some moving parts, some factors
Okay.
to it. It's going to depend on your income, but again, if it's under 20,000, you'll most likely qualify for Medicaid. Um, but there's also some interesting things too, where if you have even the option through your employer, a lot of times you won't even qualify for the marketplace just strictly because you have an option available through your employer. Even if, to your point, you end up in a deficit, some marketplace states won't even allow you to enroll into one of those. Even if you're considered low income, just strictly for the fact that you have a plan through your employer, they want you to take that over the marketplace.
Oh
So
my
there's a
goodness.
lot of nuances, and it's hard to give
Hmm.
super specifics, but it's all going to be state based because every single marketplace is governed by your own state.
Okay.
So they all have different laws, they all have different compliance, but I don't know if that answered your question about free
No,
coverage,
yeah,
like
that's
that.
helpful. That is helpful because I think that's initially when it was rolled out, that was the premise, right? Is that, well, people were getting free healthcare coverage,
Yes.
um, and again, being in the workplace, and especially during that time, and that during that time period, the political climate was interesting. So even in the work, being in HR, like people would come in and, well, there's people getting free health care. We have to pay, which,
Yeah.
looking back during that time period with that particular company, what we were paying is, I think people would pray to have those premiums today.
Yeah, I know. And they go
Yeah,
up and up every year, and
I
unfortunately,
know.
they'll most likely never go down. And especially too, each
No.
year we age, so you're never getting any
Hmm.
younger, so your insurance most likely will never go down,
Yeah.
unless you adjust your deductible to where you're increasing your deductible each year, which could potentially
Hmm.
keep your plan at least status quo from year to year. But yeah, I'm sure you can write a book on all the
Oh,
employer
yeah.
options, and they're trying to keep their costs low.
Hmm.
Usually the cost increases get passed on to the
Yeah.
employee.
Yeah.
Um,
Yeah.
yeah,
Sometimes that's the route that companies go, right? And again, it's a slippery slope.
yeah,
especially in time periods like now. So I
Yeah.
think that's something for companies to really think about. But you, as an employee sitting in that corporation who's stifling your dream and
Yeah.
holding yourself back, it's something for you to consider as well, right?
Yeah.
Many of these companies, they're experiencing inflation just like we, as your everyday average person is as well. The costs to run a business are increasing for them. And so they are going to have to offset those costs. So while
Right.
you're, kind of sitting there and thinking, well, I can't really leave because I need this healthcare package. The reality is, you're not going to be paying that much lower than if you were to go out on your own. The other thing too, I want you to kind of touch on, because you kept reminding me about the fact that, hey, because you are self-employed, you actually will be able to write off like your coverage.
Yes,
So,
that's correct. So I have an amazing CPA, and if anybody out there is self-employed, 1099, independent contractor, I recommend getting yourself a great CPA. But yes, your health insurance, everything you pay in each month, so it's called your monthly premium, that is tax deductible. There are some kind of legal things depending on if you're an S corporation or an LLC. I'm personally an S corporation, so but all that to say, my insurance, and I would say probably 90% of my clients are self-employed as well, entrepreneurs. Um, and that's one nice perk. You get to write off your monthly premiums, so that adds up when we don't have taxes withheld throughout the year. Come tax time, every dollar you paid in over those 12 months for your monthly cost, you get to write that
mhm,
off. Um, I was just talking to a friend about that today. I'm like, that doesn't mean it's free. You still have to pay your monthly cost each month, but
yeah,
certainly comes in handy at tax time when you can write that off. So you don't get to
yeah.
do that when you're a W-2 salaried employee. Um,
Hmm.
so yeah, that's
Absolutely. So that is important as well. Now, something else comes to mind. Again, just over the years dealing with circumstances, you would be surprised at the things that people you think might be common sense, but aren't
yeah,
for people, or they act like they are, maybe
yeah,
because it's, to their advantage. So, again, in America, like we know, our divorce rates are high, right?
yeah,
And I remember, like, again, me and a buddy, like, we would chuckle, like, again, when companies really started to kind of look for ways to reduce costs. Like, one of the things that they did, and again, and here's a good thing for companies to do, maybe even now, is do an audit. Like, if you do offer healthcare plans, you may want to do an audit and
yeah,
find out who you actually are covering,
yeah,
right? Because you may have individuals that you're covering on your healthcare plans that don't qualify according to your, well, one, according to the federal laws, as well as like your organization's
yeah.
policies.
Mm-hmm.
They may have children that are over the age, limits and what have you, that are still being covered, and so the company's paying part of that premium as well.
Right.
The other thing that we began to see is where, sometimes where there would be a divorce, and let's say the husband, in the judgment of the divorce, um, he received a judgment that he still needed to provide health care coverage for his ex-spouse,
Mm-hmm.
right? And the kids. And
Yeah.
so I've seen instances where they didn't connect that, and I kind of had to explain it in my way because the person wasn't getting it. And I was like, no, the judge said you have to provide healthcare coverage for her, not
Mm-hmm.
the company. Like the
Yeah.
company, because she's
Right.
no longer a dependent of yours, her spouse. So we have to take her off this healthcare plan.
Yeah.
So in those cases, um, I guess are individuals able to come to you to maybe get a healthcare plan or what have you to satisfy that court judgment,
Yes.
in the case
Absolutely.
of divorce. Okay.
Sad but
Okay.
true. I have a lot of clients actually, a lot of single moms that are going through divorces, and they're in that
Hmm.
exact situation. Either their husband is giving them, however they have it worked out with their judge, a stipend or through the alimony to pay the
Okay.
insurance, or I'll have to talk to the ex-husband and, he'll be the one paying it. But yes, I do have several clients that are in that exact situation, and we'll start talking. You can't really do too much until the divorce is finalized, because 9 times out of 10, they're on their soon to be ex-spouse's employer plan,
Mm-hmm.
until that ends through the divorce. And then they need their own coverage because, to your point, the employer technically doesn't have to cover them. They're not a dependent. They're not a spouse anymore. So that can kind of get a little convoluted. But yes, I do have a lot of clients that they're in that exact situation and they're needing coverage. They're used to being under their ex-spouses for years and years,
Mm-hmm.
and they don't know where to turn. So,
Yes. So
so
there's, yes, I wanted to bring that up because again, like if you have never had to, like, again, just think of if your spouse covered everything, right?
right.
And so they were the ones signing you up. So you didn't even have to
Right.
look at the employer plans and decide which one to pick. Like
Yeah.
it can be a little bit scary and
Yeah.
daunting. So it's good to know, like, guys, there's help out there. Natalie would be able to help you like through that process of,
Yeah.
finding the best plan to be able to transition off. Because in those cases, again, if there is a judgment that you have to provide healthcare coverage for your spouse, you
Yeah.
have to provide the healthcare coverage. The company
Right.
no longer has
Yes.
the onus or responsibility to provide that healthcare coverage.
Yeah. And if I
So,
can just be a little part in that, the last thing somebody should be worrying about and stressing about through a divorce process, they should not be worrying about their health insurance. So
yeah.
if I could get a little bit of that headache away, then I'll do that every time, because it's scary, it's confusing, you don't know what you don't know, and it's all sorts of changes happening all at once, especially if it's the middle of the year. You've already hit your deductible. Now you're on a
Mhm.
new plan, your deductible resets. It's just a lot of moving parts. So yeah, if I can kind of come in, give somebody that peace of mind, hey, we're getting that taken care of. You worry about everything else. Yeah, I love doing that.
Okay. Well, I guess since I do have you kind of in the hot seat, I'm curious to know, are you hearing any rumblings since we're probably just over 4 months, right, from open enrollment? Are you hearing any rumblings or, are you getting any like articles or a little insight around like healthcare costs going into open enrollment? Is there an expectation that there might be an increase or any little tidbits that you can share with us?
Yes. So it's interesting. There's usually all sorts of changes throughout the year, even before open enrollment. And not to be just a Debbie Downer, but I want to say it was 2 weeks ago, I just got an email. There's a carrier in Georgia. It's called Friday Health Plan. You mentioned it earlier. It's a carrier most people have never even heard of. They're available
Mhm.
in a couple states,
Yeah.
but they are just completely pulling out of the marketplace in Georgia. Now, this has happened before in years past, where there's carriers that they stop taking on new clients in the middle of the year, but they'll at least keep all their clients for that year. They'll cover them
Hmm.
through December 31st. This particular carrier is dropping every single person that's on that carrier for this year. So not only are they not
Yeah.
they're not taking new clients, they are dropping their current clients. So come July 31st,
Mhm.
every single person in Georgia on that Friday health plan has to find new coverage. And to me, that's just so unfortunate because, like I just alluded to a second ago, if you're in the middle of a health situation and you've already hit your deductible, you've already picked your doctors based on that health plan's
Yeah.
network, um, it's that's a real huge hassle. So that's just kind
Hmm.
of one thing that's going on currently, in the middle of the summer. But in terms of rates, in terms of carriers, they love to be a little discreet until usually October is when we start hearing true numbers of what the rates are going to be. I can say in years past, the marketplace usually on average increases between 10 and 15% in
Hmm.
terms of the monthly cost. So you can pretty much figure 10 to 15% there will be an increase. For the marketplace, usually private market plans are usually between 3 and 4%.
Okay.
So kind of a disparity there. I will say last year, the marketplace, those deductibles for a true high deductible plan were around 8,500, and this year they went up to 9,100. So I'm guessing if I had to take my educated guess just on trends from the last couple years, the new high deductible plan for 2024 is probably going to be around 9,500. So true
High
catastrophic
deductible.
plan at that point where you have to hit $9,500 worth of medical bills and then it's covered thereafter. So just to kind of give you that context.
Now, I guess from a high level viewpoint, and I think this helps people that are still with companies
Yeah.
because I don't think it's explained well enough, like with the corporations. Can you explain? Well, and maybe I'll use myself as the scenario, right? Again, the HR person, right? So several years ago, it was 2017. I had surgery, and
Mhm.
on my feet and on both my feet at the same time.
Oh
And
gosh.
I was traveling a lot. I was with a particular employer, and I was traveling quite a bit, running through
Mhm.
airports, and I just again we oftentimes just push through the pain
Yeah.
until it became painful, like just walking through the airport. And I already had stopped wearing heels. I was wearing Clarks a lot. Nothing wrong with Clarks because they actually are starting to make them cute, shoes now. But I was doing everything I could until the pain was unbearable, and so I finally had to go to a podiatrist that did some X-rays and said, hey. Like the bones are disconnected or what have you. So long story short, he's like, I can fix this. Like we're gonna
Mhm.
fix this. We're gonna get you better. So I had surgery. Now,
Yeah.
with the healthcare plan I had through my employer at that time, my deductible was like $3,000,
Yeah.
but my max out of pocket was I think like 5,000.
Yeah.
And
That sounds
so
about right.
this okay, so the surgery it was an outpatient surgery, and um I think it was like 13,000 or something like that when I got the
Wow.
bill. And so to my surprise, like I had the surgery, it probably was like March, right? So it was the beginning of the year, first quarter.
Mhm.
So, and aside from like the visits, because I had been seeing him, right? So I had a few doctor's visits and some dermatologist visits, but not a whole lot of major cost. And so I ended up having to pay close to that 5,000, about that five
Mhm.
up to that 5,000. And I
Right.
thought, well, no, but my deductible is 3,000. What's going on here? Are you able to shed some light on that difference, like what that difference is, and
Yes.
why that matters? Like when you're looking at these plans, again, so you understand the risk you're taking. So for
Right.
that lower hundred something dollar a month plan that has like a $9,500 deductible, but maybe a max out of pocket of like 11,000,
Right.
because that's some of what I saw when I was out there searching.
Yeah.
Um, what is that difference?
Yeah. So most people just fixate on the number that is the deductible. That is a
Mhm.
very important number, but in my opinion, your out of pocket maximum, or it can be referred to as maximum out of pocket, means the same thing. That's truly the more important number, in my opinion. That is the most you will pay out of your pocket before insurance covers 100% for the rest of the year. So, all that to say, in your situation, let's say your deductible was $3,000, you're on the hook for yourself to cover that $3,000. So you pay the first 3,000. If you've
Mhm.
ever heard the term coinsurance, that is on most employer plans it's usually 80/20.
Mhm.
It depends on the company, but yeah, so 80/20, let's assume it was an 80-20%
Yeah.
coinsurance. So what
Mhm.
that means is you pay the first 3,000 insurance pays 80%, you pay 20% of the rest of those bills up until your out-of-pocket maximum, which sounds like on your plan was $5,000. So for the next $2,000, you're going to split bills 80-20 between yourself and the insurance company. And then once you hit that 5,000, it then becomes 100% covered by insurance thereafter. So to me, if something major happens, you're going to pay that 5,000 regardless. If your bills are 13,000, like you said, or 300,000, just figure you're going to pay that first 5,000 and then it's 100% covered thereafter.
Yeah.
So most people like to just talk about the deductible number, but that max out of pocket is truly your out of pocket expense. That's
Yeah.
your exposure before it then is covered at 100% thereafter. So they're
Yeah.
both important numbers. And again, the higher the deductible, the higher the out of pocket maximum, the lower the monthly premium typically. So
Okay.
yeah,
Yeah,
hopefully.
that was a learning experience and expensive lesson,
Yeah.
but it stuck with me through the years. So I always look at that out of pocket max. Like
Yeah.
that is very important to me because that was unexpected, you know.
Right.
And so, you never know.
Yeah.
So I think, keep that in mind. The other thing I wanted to touch on too, because I know we're coming up on an hour. Like I said, my mind is just full. I just love being able to bounce all these questions right off of someone.
Oh, I could talk about this forever. I could talk your ear off.
Well, one of the things I appreciated with you is once you kind of got me, you explained like the plan that I was looking at. I think I was going to get myself in, like, had something happen, I would have been in a world of trouble. I thought that
Yeah,
5,000 out of max was because I think that one had like an $11,000 like
it,
out of
it
pocket
did.
max.
Yeah. And that's the sad thing is the majority of people that file bankruptcy due to medical bills, they have insurance. It's because
Mm,
they cannot afford their own out of pocket maximum. So they have
wow.
to file bankruptcy while having insurance because they don't even have enough in their savings account to hit their out of pocket maximum.
Wow.
So I find that super sad because it's like you're paying into it each month. And then if something
Hmm.
major happens, you don't have enough to even satisfy your own deductible and your own out of pocket maximum. So
Hmm.
that's just, we have a very broken healthcare system. Most people have been on that side of
Yeah.
things where they've gotten large medical bills or they've just been confused by their medical bills. It's I'm just
Yeah.
a big advocate on that. You need insurance, but the insurance in a lot of cases, it's kind of a messy situation out there. So yeah, that's the sad thing is the out of
Hmm.
pocket maximum, and that's too. If you do choose a very very high deductible, at least have the means of if something major happens that you can at least afford that deductible and that out of pocket maximum exposure. So
Yeah.
you're not paying for your health insurance and then still having to you know,
Hmm.
look into other options such as bankruptcy.
Yeah.
It's very
You can
sad.
strategize. Yeah. There's a way to, have some strategy around it.
Yeah, exactly.
It's
You don't want
good.
to pay too much for your monthly premium and then year over year nothing happens and then you've just been overpaying
Hmm.
for it. If we all had a crystal ball, that would be great because you could say this year nothing's going to happen to
That's
me.
true.
I'm going to prioritize a cheap plan. Next year something's going to happen. I might need a surgery. Let's do that, but that's just not the case. So I
Hmm.
tend to recommend kind of middle of the road plans. I'm not a huge proponent of the cheapest bare bones plan, but I
Hmm.
don't, most people do not need the Cadillac plan of insurance because you typically, if
Or
you're
the
healthy,
Lamborghini plan.
exactly. See what you
But
did there. Yeah. So it's very situational. I go into all that too. When I talk to somebody one on one, I'm like, do you have prescriptions? Are they name brand? Are they generics? Do you see a specialist every month? Do you typically hit your deductible? It's just, there's a lot that goes into it. And sometimes we do need to prioritize a pretty low deductible because somebody has a ton of health issues that they know
mhm.
they almost always hit their deductible by March. And at least having that low deductible, then the rest of the year they're they're getting things covered better. So
Yeah.
yeah, it's kind of a puzzle piece. It keeps me on my toes every day because every situation's very different, and I just kind of get to go in there and figure out
Hmm.
a solution for somebody. So
Yeah, and I love that you know, like I said, with me, you were able to kind of almost work backwards. So once you got me off of that horrible plan, well, it would have been horrible for me. Then, you know, we started to focus on the what was important to me,
right,
right? And kind of work backwards to find something that would be a good fit. And so
yeah,
again, I know like I don't have a whole lot of health issues. Like I pretty much
exactly.
just go for my checkups, my annual exams, but I enjoy going to the dermatologist and
Mhm.
you know, and those are really my prescriptions. I don't have other like
Yeah,
prescriptions per se. And
exactly right.
so but I do really like the doctor that I have. And so I found her again I had to leave her because of distance.
Mm.
Um when I moved, you know, to my current location now, and then she took a role with U of M at the time, but now she has her own practice. And so I happened to, you know, happen upon her online one day and I called her and I was like, yeah, I'm never leaving you. And so, so that's important to me. So any healthcare plan I have like has to be a plan that is accepted by her office. So like
Yes.
those were kind of the keys and you were able with your expertise to kind of work backwards, like with that information to narrow like the right plan for me.
Yes. That's usually the first thing I do is if somebody has a lot of doctors that they want to see, even just one, primary care, OBGYN, let's narrow down that way. Because if we are looking at marketplace and private plans, typically there's several dozen options. So we got to start somewhere, narrowing them down by the network, especially if they have doctors that they like. Then we can kind of go into the nuts and bolts of the actual coverage. But starting with that network is very important.
Mm-hmm.
Because to me, it defeats the purpose of having insurance if you can't see who you want to see. And besides doctors, you want to make sure every nearby hospital is in network because you do not want to end up on the wrong side of a hospital bill if you're on a very small network that's not accepted by that hospital. If you're out of town, if you're out of the state, you need to make sure your plan covers you out of
Mm-hmm.
state. All that, all
Yeah,
those nuances.
if you're a jet setter, like
Yeah,
now since COVID, many of us are traveling more, and
yeah,
we realize, like myself, that we don't have to be just in one place.
yeah.
You know, like I like to be in Florida, you know, and bounce back and forth. So we talked about that. Like I needed to have a plan that I wouldn't be in a tight spot to find somebody in
Right.
network.
Yeah, God forbid if you got into an accident, a car accident, or you just got sick while you're in Florida, you need to know that you
Mm-hmm.
can get care. And they're not going to deny your claims because you are out of your resident state.
Yeah.
So that's very important. A lot of my clients, really, to your point about the last couple of years, I have a lot of clients that are truck drivers and they drive over the road. They're in a different state every day, travel nurses, just a lot of those types of travel roles where you need to have that coverage regardless of the state you're in. So that's very, very important.
Okay, awesome. Well, is there anything else that you want to share that you think would be important for us to keep in mind as we kind of wrap up?
Yeah, I think a lot of the insurance industry is based on fear. They don't teach us this stuff in high school or college for the most part. So there's a lot of gatekeeping information, and I just approach everything from an educational standpoint. Not every Some people just want to get to the gist, and they're like, send me 5 plans and I'll narrow it down. Other people I can talk their ear off about, but I just truly enjoy and I'm passionate about educating people because where else are you going to learn this stuff? So I think just kind of removing fear from it. um, I just am very passionate about somebody not limiting themselves, fulfilling their dreams due to health benefits. That is so sad, so unfortunate. And I just want to be a little part of that, helping
Mm-hmm.
somebody find coverage, and not letting fear, not letting just the thought of what they've heard, oh, it's going to be so
Yeah.
expensive, I don't even know where to start. So I think just, yeah, that knowing that it's know your numbers. I
Mm-hmm.
have a lot of people that will talk to me and they're like, I think a year from now, I'm wanting to start this business. I got to know at least what's a ballpark number. What can I be expecting?
Yeah.
That's honestly my favorite conversation to have because I get to
It's a
be,
great idea.
yeah, be with them along the journey, checking in and saying, okay, if you really are serious about this, you need to have X amount of dollars set aside for your insurance each month. You can write it off, but at least that's what we're looking at. So that way you can
Mm-hmm.
plan, okay, is this feasible? Is this not? Do I need to work a couple more years to make sure I have that, um, you know, that coverage on the back end, and I'm not shocked when I hear, what it's going to cost, especially if you have a family or things like that. So
Mm-hmm.
I guess just my takeaway is don't ever let fear, stop you from pursuing your dreams, and just go out there, have a conversation, know what you're talking about, know what you're looking at, and decide from there. I never want somebody to have regrets of not doing what was on their heart because they were scared of just taking that leap of faith. You and we've talked about it. We both did it.
Yeah.
Scariest thing ever, a lot of sleepless nights, but I think doing this for 5 years, it has been the biggest blessing of my life. So,
That's awesome.
yeah,
That is
yeah,
awesome. And you're able to help other people with their
yeah,
dreams. Like that is really awesome. Like
yeah,
that speaks volumes to me. That was
mhm.
my prayer and my guiding force for
Right.
going into entrepreneurship is I was at a point, in my conversations with God where that I want to make impact and I want whatever it is that I do to be able to help benefit people. And so I am blessed that the companies that I have, they all have some capacity or component of helping people.
Yes.
And so that, that's awesome to me. So, key takeaways, guys, don't let this be a hindrance for you going after
Yeah.
your dream. I think you bring up a really great point, which I didn't even think about, and other people may think, well, no one's going to talk to me, but you bring up a great point. Again, before you make that leap, have a meeting with someone like Natalie or Natalie herself, and we're going to get into her contact information and how to get in touch with her too, and actually build some strategy around a plan to migrate into entrepreneurship fully,
Yeah.
right? Just so that you're not surprised at the different costs. And that kind of can help you with your goal setting.
Absolutely.
When you start writing your goals about like how much do I need to bring in monthly, you should factor those healthcare costs into that number. To
Yeah.
make sure that you're hitting those targets as well. The other thing, too, which again, it's personal to me, is that guys, just because you missed open enrollment, it doesn't mean it's over for you, right?
Right.
And so, like I said, I heard that misconception. And even again, like no one offered additional help when I called the marketplace. It just seemed
Mhm.
like, oh, you missed open enrollment. Oh, well, you have to wait.
Mhm.
That's not true. So a broker can help you find a short-term plan
Yeah.
that can get you from, the time period, and they
Yeah.
can be month to month. So it could be as little as 1 month, right?
Correct.
You
Yep.
don't have to
Absolutely.
link into 6 months per se.
Yes.
Um, the other thing too, most importantly, is don't be out here living raggedy. Get your priorities together and get your affairs in order. Again,
Yes.
you should be able to find a plan that fits you and fits your situation, or at least meeting with Natalie, or a broker can help you set some goals so that you can maybe shorten your time of having to be raggedy. We want to condense that. But Natalie,
Minimize the raggedy. Yes.
yes, we don't want raggedy. But it's been a pleasure talking with you again. Like, thank
You.
you, personally for helping me find the healthcare coverage that I need and find a good plan that I feel comfortable with. And again, and we'll see, like who knows, maybe, after we evaluate, we might find there's another plan that fits me, after, like during the open enrollment period, which are
Absolutely.
really which you're going to email me to remind me about. So that I don't
Yes.
miss.
And that's my biggest thing is just communication and always doing my due diligence to shop for somebody each year, because this year you might be on the best thing currently. Maybe next year they release a new plan. I take that upon myself to shop that every single couple months, every single open enrollment. That way I can say, okay, you're on the best option right now, or hey, I found something better. What are your thoughts on this? So yeah, that's super important. It's just, if you're happy with it, great. If not, what else can we look into? So
Yeah. Now, how do we get in touch with you?
yes, so I could not find my flyer. Shame on me, but my Instagram handle is at Hazel Health Insurance. So I had a friend come up with that because I have hazel eyes. So Hazel Health Insurance is my Instagram. And then if you search on Facebook, it's just Facebook/Natalie Stewart. SHS stands for Stewart Healthcare Solutions.
Okay.
And then my email, and I can also send you this after, but it's just Natalie at stewarthealthcaresolutions.com. So,
Okay. All
so
right,
yeah.
very good. Well, she has my stamp of approval, guys. Like, again, she's someone I'm personally using that has helped me and made the process so simplified. She didn't pressure me to make a decision right then. I think I was ready to, but she kind of said, "Hey, I'm going to send you some information. Read through it over, over the night." Again, you also helped me with you got me some dental information, and then you actually helped me pick a vision plan as
Yes.
well.
Yep.
So again, the full spectrum is what Natalie is able to help you, put together like the right package for you as well as for your family. So again, thank you, Natalie, for joining us. It's been a pleasure.
Thank you so much for having me. I've enjoyed it.
Yep, absolutely. All right, guys. Again, this has been Lamborghini C, another Are You Ready for Business segment. I hope that you guys took away some good gems from this. And, we'll be back week after week. Next week, we're actually going to have someone join us that is going to talk about how you're able to use insurance to help from a financial standpoint to maybe fill in the gap or as an additional investment for retirement. So she's going to speak from the perspective of, again, if you're walking away from corporate America, you're going to want to have some avenues and things available to you that you can use to be able to continue to build wealth. So we've got you covered over here.
You're doing some great work. I love it.
Yeah, thank you. All right. Bye, guys.